So we have a very critical role to play as healthcare workers, particularly frontline healthcare workers are so powerful. Firstly, you are in the first line of defense against the health impacts of climate change. You see these impacts, not in numbers, but in people's impact, in human impacts. And as such, you can raise alarms, you can raise awareness of how climate change is affecting local communities. You can identify where adaptation efforts are most acutely needed. And you can increase knowledge and awareness of local communities, both in terms of the growing health impacts of climate change and of the opportunities and the need to change your behavior, to protect yourselves as much as possible, and to demand governmental policies, robust governmental, national, and international action on climate change. That awareness raising is essential for action to happen. We as healthcare professionals, health systems, public health professionals, can also contribute quite a lot to decarbonization by more stringent air quality control measures, by supporting the transition to healthier, low carbon diets, by transitioning to more sustainable livelihoods that promote better physical and mental health. The health system, and this is something particularly important for high-income countries, contribute quite a lot to greenhouse gas emissions as well. We contribute to about 10% of all global greenhouse gas emissions, which means that we have a lot of control over the problem. And we also control we manage about 5% of greenhouse gas emissions. I think I said that wrong. But we also control about 5% of the global GDP, which means that we can have a huge influence on the global economy. And finally, we can also help shape all climate policies to ensure that they're not just protecting the environment, which is very important, that they're not just protecting the infrastructure, which is very important, not just protecting the economy, but protecting all of those for the benefit of people's health and well-being, keeping people at the center, ensuring that we're minimizing and avoiding any unintentional harms, that we're maximize people's health, people's well-being, and that we're transitioning to a future that actually sustains better lives.